Hi, Alexis. It is so good to have you with us. I'm excited. This webinar series has been just a lot of fun to do. I learn things every time I have the opportunity to interview one of our preferred partners and to talk with them about who they are and what they're doing, what they're providing in care for our community, but also what they're doing for our physician members. So, Alexis, you have been with BayCares since January 2025, I think is when you started. So, you're relatively new, but it feels like you've really kind of settled in and created a more focused vision for BayCares. So, can you tell our physician members a little bit about your background and how you came to be here in Panama City and leading BayCares?
Yes, absolutely. Thank you so much for having me today, Michelle. It's really an honor to be able to speak and share this information about BayCares that I'm really excited about. A little bit about me is, like you said, I've been at BayCares since January of this year. But previous to that, I was the community health educator for PanCare Behavioral Health. I started in that position about December of 2023 and then was so gracious to have been promoted to the BayCares executive director. And before that, I got my master's degree in public health from Tulane University in Louisiana, which is where I moved here to Florida from. So I'm really excited to be a Florida resident and to be in this position and really just address the need in our community and also more specifically tell you and the viewers today what our kind of shift in our program that we're doing. So today I wanted to talk about the new era for BayCares. And really what that is being concentrated to is prioritizing our physician partnerships.
Excellent. That's good to hear. Take it from here.
Perfect. Okay, so just a little bit of background about our organization. We were founded in 1991 by Congressman Neil Dunn and his fellow physicians, and we're a 501c3. And the whole purpose of our organization is to address access to specialty medical care for low-income uninsured residents of our community. And how we operate is licensed volunteer healthcare providers donate their time, services, resources so that our patients can receive life-preserving care. And we also assist for imaging and labs that are needed for our providers to administer care. I'm sure a lot of people watching know that specialty care often needs an MRI, CT, lab, so we make sure that our patients have access to that as well. And we strive to be the entity that coordinates our charity care in our community. And so what do we provide specifically? Our organization provides linkage to our specialty providers, of course, labs and imaging, like I was saying earlier. We're so fortunate to have an agreement with HCA Gulf Coast that provides our services at no cost to the patient. And we also have linkage to other support services. So we've really been trying to forge relationships in the community. And if a patient has a need that maybe we're not able to address, we try and make it a priority to know another organization that might be able to meet that need, whether that's food, housing, clothing, even durable medical equipment. We have connections with agencies that can provide these for our patients as well. And I also like to highlight things that we don't provide, right? Because there's kind of a misconception sometimes that we're treated like an insurance agency. So we really make it a priority to inform our patients of the graciousness of our physicians, that they're donating these services. They don't receive any compensation. So because of this, we can't pay for previous medical bills or emergency room visits. A huge purpose of our program is for our patients to, not have to utilize emergency room for non-emergent things, right? So they're able to get their significant need taken care of by a specialty provider versus, having to address that in the emergency room. And also care that is not medically necessary. So while we wish we could accept everyone, a qualification for our program is a critical or chronic illness. So if the need is able to be addressed by primary care, we'll send that referral back. But of course, if there's roadblocks along the way, for some reason, the need can't be addressed because it's documented XYZ, then, that's an instance that we can take that referral. And so who qualifies for our program, right? So our income qualification is 300% of the federal poverty line or lower. And this guideline is set in place by the Florida Department of Health, and we follow their specific criteria and guidelines when we're vetting our patients for our program. So just something I like to highlight is with our eligibility, there's that structure to it from the state as well. Like I was saying earlier, critical chronic conditions, right? So, and that's what a lot of our providers like to see as well. And of course, no insurance of any kind. And Michelle, this is a new thing that we're piloting this year that I would really like to highlight. While it is a qualification of our program for a patient to have no insurance, PanCare actually has an eligibility coordinator on staff, and their role is to help connect patients with insurance that might be feasible to them. So when a patient gets referred to us, we can also link them with the eligibility coordinator to see if there's a type of insurance that would meet their needs before we refer them to our specialty provider.
Alexis, that is really good to hear. That's an important change. And I think that's one that really is going above and beyond to make sure that that patient perhaps could have long-term healthcare and not just this one interaction with a physician. And that's really something that I know our physician members will be very happy to hear about. That's excellent. Thank you.
Thank you so much. We're really excited about it. And we're also excited we kind of get to walk them through that process, and really kind of be that guide along the way as well.
Which is 90% of the time what the problem is. They really don't know how to access, they don't know how to do the paperwork, and they need somebody to hold their hand. So kudos, that's a great improvement.
Absolutely. Thank you. And I always like to talk a little bit about our patient process as well, because it can be a little bit confusing. There's a little bit of back and forth, but usually, so we receive a referral from a primary care clinic. So that's another thing I like to tell physicians is that it's a provider that is going to be sending us a referral with medical documentation, with office notes, labs, imaging, perhaps documenting the need for specialty care. So patients can't self-refer, other support agencies can't refer, it's coming directly from a provider. And then our care coordinator will contact that patient and verify their eligibility for the program. And so if they qualify, then they'll meet with the eligibility specialist to determine if there's insurance that's feasible for them. And then we send over the inquiry to our specialty provider. We've kind of been changing that language as well, using inquiry instead of a referral, because when we send an inquiry over to our specialty providers, we don't want them to feel the pressure to accept it, right? We're just sending over the inquiry saying, hey, could you please review this? This patient meets our income criteria, and they might be a good candidate for the guidelines that you've set. So the physician will review it at that time, accept or decline the referral, and then we'll go from there. The patient will get scheduled. They follow up with us for every appointment. So we're really trying to reiterate the importance of, following up with your appointments, communication. If you have to cancel an appointment, reschedule, let us know, let the provider know in advance. So We really follow these patients very closely along the way, offering support and, following through with their care. And then once their needs fulfilled, they are sent back to their primary care provider for follow-up. So why volunteer with BayCares? I always like to talk about this because I know that our physicians are so busy with the care that they're already providing to the community. So I just like to talk about a little bit of the benefits in participating with us. So the first one is sovereign immunity. We're very lucky to have a partnership with the Department of Health, and they, were able to be that liaison and facilitate a sovereign immunity contract for the providers or their places of practice. And this just ensures that a provider is not liable for any care that is provided to a BayCares patient. And some of our providers love this. Some of our providers prefer to use their own malpractice insurance. And it's really up to them, whichever they would like. Number two, they are completely in the driver's seat. They set, however many referrals they would like to receive. They can even set the guidelines of their referrals. For an example, we might have a neurologist say, well, I wouldn't like to receive headaches. An ideal referral to me looks like this. I would sit down with that provider, have that conversation, document that, and let our care coordinator, our referring providers know, okay, this is the criteria. So, and we make sure that the patient meets that criteria before even sending them over. So that's also something that we're trying to really prioritize as well, having that streamlined communication with the providers, with the referring clinics, and with the patients as well. And also, the patient is not your permanent responsibility. Like I was saying earlier, all patients are going to come from a primary care source. So they're going to have that follow-up care, right, that they would need.
Good.
And also, if you already have uninsured patients, you can refer them to us, right? So I've even had some of our providers do this recently. They called us and said, hey, we have a patient who is uninsured. Can they come in today and, become a BayCares patient? And we said, yes, absolutely. Like I was saying earlier, we can link them with other support. If they don't have primary care, we have great partners we can refer them to. If they have a need for another specialty, we could send them to one of our other providers. If they have a scan or a lab that they need, we could also assist them with that. So that's also another thing that I like to highlight as well.
That's excellent. So Alexis, just to kind of clarify that too, and I know you're going to talk about the relationship with PanCare, but just specifically about the need for primary care or other care, that is part of your partnership and why BayCares is under the umbrella of PanCare. Isn't that correct? So that PanCare can sometimes fill that need of making sure the patient is taken care of.
Absolutely. We are so to have our partnership with PanCare, and they're able to fulfill medical needs, behavioral health needs, dental needs, vision needs, pharmacy as well. So they're able to provide a lot for our patients for sure.
Okay. I'll let you explain it a little bit further, but that's a good entrance.
You alluded to my next point perfectly. So, a question that I frequently get is BayCares a part of PanCare? There's a common misconception because of our name and we're housed out of PanCare that we're a PanCare program, but that's not true. So we have a contract with PanCare, a staffing contract. So they provide our staff with benefits, office space to see our patients, but we have retained our own 501c3 status. So we're technically a nonprofit within a nonprofit. We have our own board of directors, and we're completely financially separate than PanCare. And so another question that I get is, what if I only want to assist sometimes? Or what if I only want to accept one referral, kind of play it by ear, see how it goes? That sounds wonderful to us. we will accept any and all services, and they are greatly appreciated, even if it's just one patient. The last thing I want is for a provider to feel like they're signing up for a part-time commitment or, an overwhelming burden of patients. If that desire to volunteer is in the provider's heart, we want to respect their boundaries and, be as communicative as possible, right? About what their needs are, kind of what their patient load already looks like, and what they're comfortable with. So even if it's just one referral a year, we will say thank you and we are so appreciative of that.
Well, that's excellent because sometimes in certain specialties, when they take a patient on, it's actually a financial burden to the practice. I mean, they're not just donating their time, they're donating their staff and facility, and there's a real cost to these physicians. So I'm glad to hear they can have control of how much they want to donate and that you understand that it's just not as simple as giving their time. So I appreciate that point.
Absolutely, absolutely. We try and be as aware as possible and as respectful and really just honor that those conversations and that dedication. And then another question that we often get is what about patients with Medicaid or medically needing Medicaid? Would you take those patients? And we wish we could take every referral, um, you know, but we do make efforts to assist our patients for applying for Medicaid, like I said earlier. And this just kind of reassures our providers that the referrals that they're receiving are the individuals that are truly in those gaps of our healthcare system, right? They can be reassured that, we're screening, these patients are meeting the criteria, we're meeting the criteria that the providers are setting, and they're the patients with the most need in our community. So, and also, I really like to highlight all of our partners because, of course, we couldn't do what we're doing for the community without our volunteer providers, but we also couldn't do what we're doing without our partnerships as well. So we are so grateful. And also, this is my contact information. If anybody is interested in volunteering or even just having a conversation about, the need in the community, the patients, or even if people have more questions about our program, I would absolutely love to have a conversation.
Excellent. Well, this was really valuable information, Alexis. And I am happy to tell our membership, I actually serve on the board of directors for BayCares as well. And I'm representing you as our physician members and speaking directly with Alexis and advocating for what you want. So please feel free to contact me as well directly. And I have found Alexis to be incredibly open. She has fresh views and thoughts, and she stands her ground on the things that she believes are right for working with physicians. So for that, I thank you, Alexis, and I look forward to further opportunities to partner with you. Thank you.
Absolutely. Thank you, Michelle.